So in this video we're going to go over simple follow-up hip internal rotation mobilization, something what you can do after, let's say, some manual therapy or maybe a bent hip distraction, something when you were able to improve that hip rotation on the table or passive range. And you would like to do something which is going to help you to get that motion, that hip internal rotation into your daily life. So starting in a standing position, you're going to just create a nice tripod on the foot, so just nice stable foot, and then from this position you're just going to reach basically across. Super simple, super easy, just like this. Initially you might put a little bit of weight over that side and just go back. Just put a little bit of weight and just come back. A little bit of struggle, a little bit of losing balance is perfectly normal. You can try the same on your side. So what you're trying to do is, while keeping the foot pointing forward, you're trying to rotate your pelvis over here. So it's not just reaching with the foot, keeping the pelvis still, but it's rotating around, trying to reach. And then maybe just touch. And again, a few repetitions of those. Kind of quite important thing is you're trying to maintain this portion of the foot in the contact with the floor, so just make sure that you squeeze it into the floor, that you are not rolling on the outside of your foot, that you are training the nice supination. And again, just rotate, build it up. And again, like losing a little bit of balance is perfectly fine, and make sure that the other side is able to rotate quite nicely too. From the programming standpoint then, for the repetitions, because this is such a simple movement, this can be done multiple times a day. Let's say when you are in the office and you go to the toilet or things like that, you can just sneak in a few of those motions. With getting the range of motion and with changing the awareness, changing the little bit of coordination, it's more important that you do it more often rather than 3 sets of 10 or 15 repetitions. So I would try to get it almost like a movement snack every hour or so, especially during the first few days. You might notice then your hip internal rotation is going to become way easier, way looser, because your body is going to be able to access it quite long. Usually the nice follow-up towards that would be to practice some kind of movements which are going to challenge that movement, that hip internal rotation, into either eccentric or concentric fashion, but we're going to talk about it a little bit later. Okay guys, hopefully this was helpful. Good luck.